everyone, welcome to another video. So in the last video we treated Down syndrome, which is basically having an extra chromosome 21. So in today's video we're going to be looking at Turner syndrome. So what's Turner syndrome? Turner syndrome is a genetic condition that primarily only affects females. So it happens when one of the two X chromosomes is missing completely or partially, and this missing genetic material leads to a range of developmental problems, especially leading to growth problems or problems related to puberty, fertility, and sometimes problems related to learning. So it was first described by a man known as Dr. Henry Turner in 1938, and it is a lifelong condition, but with proper care, most girls and women with this Turner syndrome, they can live healthy lives. So in normal female development, each cell has two X chromosomes written as 46XX. So chromosomes are the structures in the cells that carry genes. So basically they are blueprints for how the body works. So in cases of Turner syndrome, a girl is born with only one X chromosome or with a partially missing second X chromosome. So in this case it will be written as 45X or other variations. So this affects how the ovaries, heart, kidneys, bones, and other parts of the body grows and functions. So the ovaries, which produce female sex hormones like estrogen and progesterone, they may not function well, or they may not function at all, leading to infertility and like delayed puberty, because they play a function in all these roles. So looking at the pathophysiology of this Turner syndrome, the cause is non-disjunction, a random error during the formation of reproductive cells, that is the sperm or egg, where a sex chromosome is lost. So in Turner syndrome, this means that one X chromosome is missing or structurally abnormal in all or some of the girl cells, because the second X chromosome carries many important genes. Its absence leads to, number one, impaired sexual development, that is having delayed or absent puberty. Then number two, short stature due to lack of genes that can influence the bone growth. Then organ malformations like the heart, the kidneys, the ear, and also having like thyroid problems. So the cause of Turner syndrome, well, Turner syndrome is not inherited, so it happens by chance during cell division, usually in the father's sperm or the mother's egg. So there is no known environmental or lifestyle cause of this Turner syndrome. So it is also not caused by anything the parents did, similar to what I said about Down syndrome. So it can happen by chance. So there are several types of this Turner syndrome. There is, number one, there is complete monosomy X. This is when one entire X chromosome is missing, and this is the most common form. Just like the most common form of Down syndrome was trisomy 21. Then we also have mosaic Turner syndrome. So mosaic Turner syndrome, in this case, some cells have two sex chromosomes while others have only one. Then we also have structural changes in the X chromosomes like ring or deleted chromosomes. So these are all the several types of Turner syndrome. So for the signs and symptoms, the symptoms can vary widely, but the common features include, number one, the features that we can see at birth or early childhood can include like swollen hands and feet, broad chest with widely spaced nipples, then webbed neck, like having extra skin folds, then also having a low hairline at the back of the head, and also short stature, which is noticeable by the age of 5. Then when the girl starts reaching like school years. There will be signs of delayed growth, learning difficulties, especially with maths or spatial reasoning. Then social challenges like shyness, difficulty with peer relationships. Then also during when she's experiencing puberty, there will be lack of breast development, no menstrual periods, failure to start or even complete the puberty even if she starts. Then infertility due to poorly developed ovaries. Then other health problems like that can follow include heart defects like narrowing of the aorta, kidney problems or abnormalities, then hearing loss, underactive thyroid gland, and also increased risk of high blood pressure, diabetes, and osteoporosis. So for the differential diagnosis, we have neonatal syndrome. Then there's also androgen insensitivity syndrome, growth hormone deficiency, hypopituitarism, and other chromosomal disorders like triple X syndrome. So how do we diagnose Turner syndrome? Diagnosis of Turner syndrome can be made before birth, that is during prenatal screening, that is through chorionic villus sampling or amniocentesis, similar to how we diagnose Down syndrome. So if we check for signs like fluid at the back of the neck, which are usually noticed in a scan, then at birth it can also be diagnosed based on physical features and confirmed test by karyotype testing, which is a chromosome analysis. Then it can also be diagnosed later in life if puberty is delayed or there are fertility issues. So in this case, a confirmatory karyotype test can also be done. So for the treatment of Turner syndrome, there is no cure for Turner syndrome, but treatment can help manage symptoms and improve development. So there can be growth hormone therapy to increase the height in childhood, then estrogen therapy to start puberty and develop breast, and then progesterone may be added later to create like a regular menstrual cycle. Then fertility options, so most women are infertile, like most women that have this condition, they are infertile, but they can be assisted reproductive technologies like egg donation. So all these things can help. Then surgery or medication may be needed depending on if the lady in question has like heart problems or kidney problems or like hearing difficulties, or like having, also if she has like an underactive thyroid. So medications can be given to help in this case. So for the management of Turner syndrome, so the management is actually lifelong, and it involves a multidisciplinary team with a lot of professionals. So basically their role is to educate the patient and the families about the hormone therapies, how and when to take them, the side effects and the long-term benefits. Then monitoring for drug interactions, especially with growth hormones or estrogen, and also encouraging this set of patients to adhere to their therapies that they are taking, because it's a lifelong therapy, so it can be quite hard to adhere to therapies that you have to take like every single day of your life. So trying to encourage them to adhere to these therapies, and also like providing guidance on, for example, calcium and vitamin D supplementation to help with their bone health. So in summary, Turner syndrome is a genetic condition affecting females only, and it's due to a missing or altered X chromosome, and it often leads to short height, delayed puberty, infertility, and possible organ issues. And although there is no cure for Turner syndrome, like early diagnosis and hormone treatments can help the affected individuals to live normal lives and healthy lives. So it is essential that healthcare professionals that are in charge of these patients, that they try to counsel them well on the medications they are taking and encourage them to adhere to the medications and give them long-term medication support. So thank you for watching this video, and I'll see you in the next video. Bye.